For years, most of us believed that cosmetic surgery was just for the rich and famous. Well, now more and more people from all walks of life are turning to cosmetic surgery to improve their appearances and just to feel better. I'm Jill Scott, Mrs. America 1991, and I've had the opportunity firsthand to see just how cosmetic surgery can improve people's lives. That's why I'm so pleased to host this program and to introduce you to Dr. Louis Altman, a board-certified women's doctor. Dr. Altman specializes in cosmetic surgery, and he's up to date on the latest techniques and advances, some of which we'll see in this program. I'd like to introduce to you Dr. Louis Altman, who specializes in cosmetic surgery for women, and he's going to provide some real insights on body contouring through breast enhancement, liposuction, and tummy tucks. Later, Dr. Altman will talk about eyelid beautification and women's health. Joining us today is Laura Mullins, one of many of Dr. Altman's patients, and she's going to share with us about her cosmetic surgery. Take my word for it. This will be one of the most informative programs on cosmetic surgery that you will ever see. There are some misconceptions about breast enlargement, so let's get right down to it. Dr. Altman, what is all this confusion about?
Confusion is about whether the silicone gel implants are safe. The FDA and the media have given a lot of bad publicity to the silicone gel implants, and I think a lot of it's unnecessary. They've been used for over 30 years with an excellent record of safety. However, the FDA is right in saying that they've never had any real clinical studies, and they're demanding that they be done now. This will probably end up being beneficial for patients, and in the long run will probably be the best thing to do. They have relaxed the ban on silicone gel implants so that if a patient has one and she has a problem with it or ruptures, it can be replaced now without much difficulty.
Oh, that's great. So are the saline-filled implants the best?
They are different. They're the ones we can use in anyone now. I brought one with me for you to take a look at. They are soft and they're pliable, and of course, if they would rupture or this is just salt water is released and it's expelled, and there's no problem with that.
Well, how are these inserted? Do they leave scars?
You can insert them through the same incisions that the silicone implant was inserted. However, interestingly enough, you can make the incision even smaller because these can be inserted, partially inflated, and then inflated after they're in. They're filled at the time of surgery, and they are inserted usually through a lower breast incision, which is the old traditional incision, a periareolar incision, which is the most popular, and even under the arm incisions.
Oh, I see. Well, now, Phyllis jokes about it, but do women ever really want to look like Dolly Parton? I mean, is that real?
Yes.
That is real?
Yes. Our office, strange as it seems,
good news
our
for men,
office,
isn't it?
Does do sizing of patients before breast augmentation procedures so that we get some idea of really what the woman wants to look like, and we can most closely match what she envisions herself to be.
Well, that's nice to know. What about the recovery? Is it long?
Well, most patients go back to work in 7 days.
Wow.
With some swelling and some bruising still, but the pain is really at a minimum, and I think 7 days is a reasonable time to take off.
Well, we want to talk with Laura in just a moment, but first I want to ask you about the breast lift, and what technique did you use exactly with that?
The traditional breast lift was a anchor type scar which patients really disliked. It was a lovely lift, but it left major scars in the breast that patients were unhappy about. A French surgeon named Dr. Bonelli in Paris developed a new breast lift, which I had the privilege to work with him to watch him do this and to do them. And this is a lift that has some restrictions, but it essentially leaves only a scar around the areola, which is hidden very well.
Oh, that's great news. Well, Laura, tell us about it. Tell us how you feel about it and what your experience was.
I feel that it was great. It gave me a lot more self-confidence. I can fit into bathing suits like I couldn't fit into them very well before.
And it's summertime,
and
so
summertime is coming up. I have had people comment how much better I look. I think a lot of it has to do with self-confidence too, because I feel better about myself. Because I think the most important thing is to do the surgery for yourself.
I agree. Well, you look great.
Thank you.
And your recovery time was quick?
I recovered very quickly. In fact, I had expected a lot worse, and it was really pretty easy. And Dr. Altman, of course, what made me feel a lot better. He was very easy to talk to, and if I had any problems, I could call him right away. So.
Thank you for joining us, Laura. I'll be right back with Dr. Altman and another patient who's going to tell us about her body contouring through liposuction and a tummy tuck. But first, we'll listen to another patient talk about her breast enhancement procedure.
Hi, my name is Sherry, and I've had breast augmentation. I always felt like I was lacking, so I decided to seek out a doctor and see what my options were. And I met with Dr. Altman, and he reassured me that he could make me feel better about myself by having the procedure done, which I did. It was a little scary, a little painful, but it really helped my self-esteem. I feel much better about myself. I look great. My husband thinks they're awesome, to say the least. And the recovery time was about 6 weeks, which I had expected. Most of my family and friends think it's great. My mom was a little apprehensive, but she's my mom. I feel if I needed something else or wanted something else, I would go back to Dr. Altman. He's great. He's very reassuring, and I could put my confidence in him. He's trustworthy, and I'm very happy with what he did for me and my results.
If you're interested in more information about breast enhancement or other cosmetic surgery procedures, please feel free to call Dr. Altman's office at 985-9683. We also offer specialized financing programs designed to make cosmetic surgery more affordable. For further information or to schedule a consultation with Dr. Altman, please call 985-9683.
Sometimes, regardless of how much we diet and exercise, it's nearly impossible to get rid of that unwanted fat in our thighs, our upper arms, even our chin area, just to name a few. To alleviate this problem, Dr. Altman is combining liposuction with skin tightening procedures. Isn't it amazing how we're able to regain a trim and more youthful appearance? Let's take a look and see how Dr. Altman is helping more and more women get rid of that unwanted fat. Welcome back. Joining us is Sue Levy. But first, I have one big question. Can liposuction really remove the fat that diet and exercise can't?
Yes, liposuction does work. Exercise is really great for toning muscles, and dieting is great for shrinking the present fat cells that you have, but only liposuction removes fat cells.
How's that procedure work?
We use cannulas, something like this. This is a 4mm cannula. It's an average size cannula, and this is inserted through a very small incision underneath the skin after the patient has been either properly anesthetized, and the other end is hooked to a suction apparatus, and the fat is removed. And you remove as much fat as necessary to make the area look well.
It's small. That surprises me.
Yes.
Does the fat ever come back?
No, it doesn't come back. And women will find that areas that have been liposuctioned are the first to lose weight when you diet and the last to gain weight when you don't.
Well, what role does a tummy tuck play in body contouring?
There are some times when the skin is not elastic, either because of having children or weight gain or weight loss. And women who have that many stretch marks will know what I mean by loss of elasticity of the skin. And so the skin is loose, and when you liposuction that area, the skin will be looser. So you have to take up the slack, so to speak. You can do this by either taking out a segment of skin, which is a mini tuck, or you can actually do what's called an abdominoplasty, which is removing the lower half of the abdomen, essentially, and remaking the whole abdomen with a new belly button and everything.
Wow.
It works really well.
Well, let's meet Sue. Sue, I understand you had both liposuction and a tummy tuck.
Correct. Well, I had the abdominoplasty.
So tell us about that.
I love it. And I have been out of surgery just 3 weeks.
3 weeks,
And
wow.
you can already see such a difference. In fact, I could see a difference the very next day as far as the liposuction went. Doctor told me that I'd be able to, and I was a little skeptical, and I mean, it was fantastic because that gives you, when you're in a little bit of pain, you think, and you can see it right away, it's worth every bit of it.
Oh, so right away you notice the difference.
Absolutely. With the liposuction, the abdominoplasty, you have to walk over, hunched over a little tiny bit the first week, and I went back to see him last, a couple days ago, and it was fantastic. I couldn't believe how good it looks. The incision's wonderful. His bedside manner is fantastic. So, but he's been my doctor for a long time. His staff is wonderful, and I think that makes a big difference.
I saw you walking around. It's just amazing. 3 weeks.
That's it. And I had even had hand surgery the week after, 2 weeks after I had the other. That it was by another doctor that I had to do. That's how good you feel. Is it just?
Great.
She's very tough.
What about the pain then? You don't feel
pain,
you really...
Well, you know what? It was worth it. It's something I had wanted to do for a long time. I think he's been drawing pictures on me for the last 3 years that I went in, and I finally decided that this is something I wanted to do for me. And it just made all the difference in the world. And I know that if I'm this happy after 3 weeks, it'll just get better.
you really do look happy. I'm ready to sign up. It
if you
sounds great.
listen to what he says, and I think I did completely and totally listen to exactly what he said, what his staff said to do, it makes a big difference because if you take care of yourself, which he wants you to do, then you're going to be okay.
Great.
I love it.
Great. You look great.
Thank you.
Well, thank you for joining us, Sue.
You're welcome.
And we'll be right back to find out what Dr. Altman has to say about how to get rid of that droopy, tired eye look.
Hi, my name is Val, and about 4 weeks ago I went through several procedures that I would like to describe to you. First of all, I had a tummy tuck. I also had liposuction on my upper abdomen, and I had a breast enlargement. The reason for those procedures were several. First of all, after I had my daughter, my stomach had been stretched very badly, and I had stretch marks which went quite a bit above my belly button. I also had love handles on the side, which I did not like, and basically did not have a good figure. I was not interested necessarily on enlarging my breasts, but what I was interested in was improving the shape and the volume of them. I decided to go ahead with this procedure when, speaking with Dr. Altman, he explained to me how I could go through the tummy tuck process and also the breast enlargement without any scarring above in the chest area. And the way he did that was he placed the implants through the tummy tuck area and went underneath the skin and implanted them into the breast. Now I had all of this done 4 weeks ago, and it was all done at the same time. I was in the hospital for 1 day, and the following day when I was released, it was a fairly painful day for me. It basically took me 3 days to start feeling good again, but with pain medication and a lot of rest, a lot of water, and so on, I began to feel quite good within 3 days. Within a week, I was up and moving around, dressing myself, and able to take care of my daily activities on a limited basis. By the second week, I was fairly well on my feet and on the road to recovery, and this is my 4th week, and I feel very good. As I say, the reason I decided to do these procedures was I needed to improve the shape of my body, and I did. I feel really good. It has decreased the size of my tummy. It's decreased the size of my hips. I have a nicer overall basic shape. When I first went in to see Dr. Altman, I wasn't completely sure whether I wanted to even go through this process. But he spent about 2 hours talking to me, showing me pictures, explaining the procedures, telling me all of the alternatives and what the results would be. And he was so helpful and informative that I thought about it for a day, and the next day I phoned and set up an appointment to proceed with it. And I'm really thrilled with the results. I can't tell you how happy I am, and it has changed my whole self-esteem.
If you're interested in liposuction, a tummy tuck, or any cosmetic procedure, please feel free to call Dr. Altman's office at 985-9683. We also offer specialized financing programs designed to make cosmetic surgery more affordable. For further information or to schedule a consultation with Dr. Altman, please call 985-9683.
Though we may still feel young inside, when our face begins to age, we do feel concerned both socially and for business reasons. Fortunately for us, Dr. Altman also provides facial rejuvenation procedures. Sometimes a facelift is combined with liposuction of the neck and chin to create a more youthful appearance. Often a forehead or brow lift will be utilized to achieve proper facial proportion to maximize beauty. And Dr. Altman offers freshening skin treatments for rejuvenating sun-damaged skin. Speaking about feeling as young as you look, what about youthful eyes? Let's rejoin Dr. Altman and see what his approach is on getting rid of those baggy, droopy, and tired eyelids. Welcome back. Joining us is Cynthia Donald and Diane Bass. Welcome, ladies.
Thank you.
Dr. Altman, before we go into eyelid beautification, I have to talk about your credentials because they are so impressive.
Thank you.
You're formerly chairman of the OB/GYN Department for San Antonio Community Hospital. You were a clinical instructor at UCLA, and you're a fellow of the American Academy of Cosmetic Surgery, the American Society of Liposuction Surgery, as well as a fellow of the American Society of Cosmetic Breast Surgery. Whew, that's impressive.
Thank you.
However, I think what I'm most impressed about is the fact that you are a board-certified woman's doctor.
Thank you. I spent my whole professional career taking care of women. And although, as a man, of course, I realize that one can never really understand women, I think it gives those of us who do this a special sensitivity or consideration so that in dealing with women, and especially in cosmetic surgery, we can do a little better job and understand the patient and her needs a little better.
I know personally, if I knew that someone was a board-certified women's doctor, I would head straight in there. I really find that impressive.
Thank you very much. Thank you.
And you specialize in eyelid surgery.
Yes.
When do you find that it's important to do that to women? Is there a certain age or?
Well, this is usually a procedure done in older women. However, it has been done in women as young as their teens. In the upper eyelids, it's usually a matter of too much skin and fat beginning to weigh the eyelids down so that the patient has difficulty seeing, and she has a tendency to be looking up like this instead of raising her eyes because she can't see above her lids. To repair this, you take out the excess skin and fat, and you can make a really lovely new crease for makeup, and it rejuvenates the eye and makes the patients look years younger.
So it's not only that it helps that they can see a lot better, but it makes such a huge difference in the way they look as well.
Yes, it does.
It takes
and
years.
Interestingly enough, insurance covers many of these cases of upper eyelid surgery. On the lower lids, it's a little different. That's almost always done for cosmetic surgery, or for cosmetic reasons.
The puffiness, is that?
Yeah, the puffy eyes, the bags under the eyes. Patients who have this always look tired, and repairing this and fixing this, it just gives the whole face a new look. It really is a remarkable change.
Well, as a woman's doctor, you also do gynecology procedures such as hormone replacement therapy.
Correct. This is a very big part of my practice, and I have a large group of patients who are under hormone replacement therapy because they've either had their ovaries removed or they've gone through menopause, which is a normal aging process. Essentially, hormones delay the aging process. They prevent the skin from drying and wrinkling and have many, in general, health effects that are greatly beneficial, including decreasing heart attacks and strokes in women and making their bones stronger. Our only problem is we men have nothing for us to keep us younger.
But I like to know you're looking after the ladies.
Thank you, thank you.
What is rollerball surgery?
Well, we have some new toys to play with in our specialty. And this is a new procedure that's really fun for many of us to do. This is an alternative to hysterectomy for the woman who doesn't want any more children. She's having bleeding problems, can't take 6 weeks off from work, and wants this problem to be solved. Essentially, this is a very short procedure. Recovery time is usually less than a week, and the patient doesn't have any more bleeding. Of course, she can't have any children either. It's a very nice procedure, and for the woman who needs this kind of specific procedure.
Well, you know, I have been accused of having PMS, which I take offense to, but it is really a serious problem, isn't it?
It is a problem, and it is a real problem, and I do treat it.
Well, that's a great thing to know. I understand that it's possible to combine cosmetic procedures while you're doing gynecology procedures. This is done all the time. It is a time saving for the patient that she can have two procedures done at the same time. It is sometimes less expensive for the patient. And while she's recovering from her gynecology procedure, of course, the recovery for the cosmetic procedure is being taken care of at the same time. So it really is a very advantageous way to do it. Oh, I'll say. And Cynthia, how did things work for you?
Things went great. I recovered quickly, and I was uncomfortable just for a few days, and everything went very well.
Well, you look great. Tell us
what we did.
Yeah, what did you do?
I had breast augmentation, and I had a tubal ligation at the same time.
Wow.
I was 36 years old, and I felt that I did not want any more children. I've always wanted to have my breasts done, and it was Dr. Altman's idea that I have them both done at the same time. And it worked out beautifully for me. I'm very, very pleased with the results.
What a great benefit that you can go in and take care of two procedures like that at the same time. I don't think that there's many doctors that do that.
More and more are doing it now.
I think that's great. And Diane Besh, you are the office manager.
That's right.
And you keep this man in line, is that right?
I try to. That's hard.
And you have had breast enlargement, liposuction, and a tummy tuck. Is that right?
That's correct. He's also done gynecology procedures on me. I had a hysterectomy in 1984, and that was the first surgery he ever did for me.
On you?
On me.
Let's make that real clear. It was on you.
And I have a long list of surgeries. And then he did a breast augmentation about 3 or 4 years ago, and then about a year ago I had liposuction and a mini tuck. And then I had a surgery emergency come up about 3 weeks ago where he did a gynecology procedure, and at the same time I also asked him to do a little more liposuction here and there. And I'm real pleased with that. The best thing about this is the procedure he did is one of the brand new gynecology procedure, and basically what it is he was able to get me back to work in about a week and a half versus 6 weeks.
It's important for him to get you back to work since you work for him.
My boss and my doctor are the same. So anyway, why don't you go ahead and tell them exactly what you did, since it's all new. And
this is a brand new field that's called operative laparoscopy or pelviscopy. Essentially, we took out Diane's ovaries and tubes through 3 tiny incisions. This is a kind of surgery where a patient would be in the hospital usually 2 to 3 days, and some patients go home the same day, and most go home the very next day at the latest. And you really can get back to work quickly. Unfortunately for Diane, since she's my employee, she had to come back to work in 9 days.
Yeah, you couldn't.
But many patients can take off the full time, but the recovery is just super.
And that's important because women, I think they would be really concerned about that amount of time because most women have such an active life.
Normally, the girls would have 6 weeks, 8 weeks off for a laparotomy. They can go back as early as maybe 4 or 5, but it's still kind of pushing it. And I was, by 3 weeks, I was really feeling good. I would give the girls 2 or 3 weeks, though, when we do the disability. But a week and a half, it can be done.
Well, you must be one of his greatest fans, then.
Yes. She has no pain threshold, though.
she gets to see the patients coming in and then coming back after surgery, and I bet you get to see their excitement, and
That's one of the reasons I had my cosmetic procedures done, because it's nice seeing all the results. And
Sure,
kinda
you
wanna
watched
be-
everybody come in and out and you
Exactly.
knew this is what you needed,
Yeah,
right?
this is what I want too. So.
Well, you look great.
Well, thank you.
And thank you both for joining us. And thank you, Dr. Altman, for being so informative today.
Thank you.
You know, I learned quite a bit myself. I must say that choosing the right surgeon is one of the most important aspects. I strongly recommend Dr. Altman. As you've seen here today from his patients, he's sensitive, caring. He truly is a woman's doctor. Call his office today for your consultation. You'll be pleased.
If you're interested in more information about breast enhancement, liposuction, tummy tucks, eyelid beautification, or a gynecology problem, call Dr. Lewis Altman's office for an appointment. Remember, we also offer specialized financing programs designed to make cosmetic surgery more affordable. For further information or to schedule a consultation with Dr. Altman, please call 985-9683.